Capital Investments Committee will come to order. Clerk will note the roll of people come in. First item on the agenda is fourth on the agenda, Western Lake Superior Sanitary District, Representative Sundin. He inherited the Western Lake Superior Sanitary District. Welcome.
Thank you, Madam Chair. We have a bill in front of us, 959, that provides for $5,280,000 in appropriation of bond proceeds to facilitate the improvements at the Western Lake Superior Sanitary District in Duluth, Minnesota. The district serves several communities in probably a 30-mile radius of their facility, and they do a fine job. The project that is under consideration today is a combined heat and power energy project where this
Western Lake Superior Sanitary District
to utilize the waste energy that is currently being bypassed, and these generators will actually increase the capacity for self-reliance for energy independence for that facility. So I have with me today Marianne Bourne, who knows more about the WLSSD than 10 people put together.
You're absolutely correct, Representative Sundin. There is a technical change in your introduction. You don't want appropriation bonds, you want GO bonds.
Thank you, Madam Chair.
Okay. Welcome, Director Bourne.
Thank you, Madam Chair, members of the committee. You do have a folder that's included in your materials, and I'm going to reference a few materials out of that. As Representative Sundin said, we're the Western Lake Superior Sanitary District, and you have a little card in the folder that we provided for you that tells you a little bit about us. We are a regional wastewater treatment facility. We were very fortunate in 2018 to celebrate our 40th anniversary and helping keep the St. Louis River clean. You can see in the front the statistics. We serve 17 municipal communities and 4 major industries. Each and every year, we treat almost 14 billion gallons of wastewater, and we also have solid waste authority. So we cover a 530 square mile area and have a significant number of customers. And we feel that if you turn over to the back, it talks a little bit about what's important to us. We see ourselves primarily as an environmental and public health organization. We had a tremendous impact when we were put into state statute and created in cleaning up the St. Louis River. Like many regional utilities, one of the challenges that we have had in the last several years is we have a lot of infrastructure. How do you pay for all of this infrastructure? How do you keep rates affordable for your residential customers and your business customers? And so one of the things that we do as a public utility is strategic planning. And part of our strategic planning effort is trying to look at what are opportunities that we can do to really both improve the environment but also control rates. And one of the things that became quite apparent to us about 5 to 10 years ago is our ability to really supply ourselves with our own source of electricity. Because in treating wastewater, we generate a methane-based biogas, which we collect during cold weather months like we are having right now and use for building heat. But in warm weather months, that particular energy source is just flared and wasted. So what I'd like to do, if we can call it up here, is to go and give you just kind of an overview of the project in a really simplistic, less than 2-minute video. All right, Emily, I'm going to need you to call yourself up here.
WLSSD covers a 530 square mile region located at the edge of Lake Superior. WLSSD serves 17 communities and 4 major industries. 140,000 people make their homes here. Every day, 40 million gallons of wastewater flow from homes, businesses, and industries to the treatment plant, where the water is cleaned and sent to the St. Louis River and then flows onward to Lake Superior. The solids removed from the process are further treated through anaerobic digestion. This provides big opportunities for WLSSD. In the digesters, wastewater solids are broken down by helpful bacteria in large tanks at high temperatures. The solids are transformed into a high-quality fertilizer used by local farmers. The bacteria generate heat that is captured and reused to maintain the tank's high temperatures. They also produce a methane-rich biogas that can be harnessed for energy. WLSSD uses some biogas to heat buildings, but isn't able to use it all. Unused gas is wasted. But the time has come to change all that. WLSSD seeks to use all its biogas and to increase the biogas produced. The gas will be cleaned and used in generators to create electricity. The heat produced by the generators will be recovered and reused. To make even more biogas, other wastes like food scraps or fats, oils, and grease can be added to the tanks. WLSSD already receives food waste from local businesses for composting. The tanks have plenty of room for more waste, so increased gas production is possible with existing equipment. WLSSD's combined heat and power project is truly sustainable. It effectively uses existing infrastructure to make the very most out of waste.
So in your folder, you also have a summary of the video, and it has a link of where you can find it in case some of your family and friends would like to watch this on their own, because it is a very nice explanation. The project itself, I think the question is, what are we asking for and why now? We have been, for the last 6 years, really focused on becoming energy efficient and energy self-sufficient. And that has involved a number of projects that we have completed. One of which, our heating system. We converted our heating system from steam to hot water. We have 8 modular boiler units, which allow us to heat the facility very, very efficiently. We've looked at decreasing the amount of chemical and oxygen we need to treat wastewater. And as a result, we've also participated with the Department of Energy in a 5-year consortium study on wastewater facilities and how they become more energy efficient. One of the things I'd like to point out is the project itself that we're working with the Department of Energy on uses 2015 as a baseline year with the goal of a 5% energy reduction each year for 5 years. For calendar year 2017, the district had already reached 14.9%, and we will be highlighted by the Department of Energy for that. But as we're reducing our overall energy consumption, that makes installing the generators even more important, because we are now to the point where if we had engine generators, which is what our request is for, we'd be able to take the biogas that we produce and convert it into electricity for our own use. We have been on the bonding request now for 3 years running, and for 2018 we did have rider language in the bonding bill, which allowed us to qualify for WIF grant infrastructure fund for the same project. Unfortunately, we've done that now for 2 years, and as all of you know, there's a huge backlog of projects, and when bonding money is appropriated, PFA, the backlogged projects have already taken that. We are moving forward with engineering the project, and in the past month have sat down with engine generator providers. We went out for proposal. We got 11 proposals back, which was much better than we anticipated, with very favorable pricing. And so the project itself, we are ready to sign on the dotted line here in spring and have the project start in late summer, early fall. The only thing that, of course, holds that up is we have budgeted for our half of the project, and we are hopefully asking that the state does, if they have a bonding bill, that WLSSD's project is included at $5.28 million. If it doesn't move forward this year, we will have to put things on hold. We have not increased our ask over the last 3 years, And we do believe we can get the project done within what we're asking for because, again, very favorable pricing, which is a good thing, and we'd like to take advantage of that. I think the final point is, what is the benefit? Why would we do this? I would, I think, highlight a couple things. One is, it is very, very unusual to find a project that not only has an environmental benefit, but also saves customers money. Electricity purchases for WLSSD make up over $3 million of our operating costs, and that's about 35%. And those costs are going to continue to rise. The other thing is, we were, unfortunately, one of those areas of the state that were impacted by a natural disaster not very long ago. People will remember the flood. Our ability to create our own electricity and power our own facility helps the resiliency of the plant as well. And from a savings standpoint, as we move towards more and more energy self-sufficiency, we expect that we can save our users upwards of $1 million a year. That's money we can use for other capital projects. That's money that our customers can use, whether you're a homeowner or whether you're a business. And if it behooves the chair, I think we also have one of our industrial customers that would like to also testify in regard to this project.
The forest industries. Thank you. What was that word?
Anaerobic digestion.
Digestion. And it's the digestion part that we buy, we purchase, and then our flowers really grow really nice in the garden.
So yes, so the wastewater treatment plant, the solids, when you're done treating the wastewater, go into 4 million-gallon anaerobic digestion tanks that the district spent $30 million on back in 2001. It's in digesting those solids that the biogas that we utilize for that we will be utilizing for electricity comes from, and the solids that come out of the anaerobic digestion process are land applied, and that is our biosolids program, yes.
Thank you. Mr. Brandt.
Thank you, Madam Chair. Members of the committee, my name is Wayne Brandt. I'm the Executive Vice President of Minnesota Forest Industries. Minnesota Forest Industries members include paper mills, sawmills, engineered wood products facilities, forest landowners, renewable energy producers. So we are the forest products industry. 2 of our paper mills located in Cloquet and in Duluth discharge their effluent to the Western Lake Superior Sanitary District. So that is our interest in the project. We are a large customer of the sanitary district. Our interest is in the safe, effective and efficient operation of the sanitary district. As Mary Ann cited, costs are a significant factor for the sanitary district. They're a significant factor for us. We think that this project is truly a win-win. Capturing methane that is currently being flared and generating renewable electricity for the facility. Again, truly a win-win. We support the project very strongly and look forward to continuing to work with the sanitary district on making it a success. Thank you.
Thank you.
The other thing you will see in your packet is a list of the letters and resolutions of support from member communities and industrial customers as well.
Thank you very much. Any further questions? If not, thank you for your presentation and thank you for being first. The next item on the agenda is Clay County Resources Recovery Campus. Representative Lean. Welcome to the committee.
Thank you, Madam Chair. Good morning. Good morning, committee members. And I appreciate you all hearing this bill today, House File 177. Madam Chair, I understand this is going to be an informational hearing.
Correct.
Thank you. This bill is a capital investment request through the Pollution Control Agency for $8.5 million and this would fund a new solid waste transfer station and problem materials facility in Clay County. The county did receive $600,000 in 2014 through the PCA for planning the facility, and the facility is now shovel-ready. The new facility would consolidate 3 existing solid waste facilities in Clay County, currently spread out amongst 2 different locations into one facility at one location. It would save the county money by not having to send problem waste to another county for sorting. Also, the current solid waste facilities in Clay County are aging and in need of repair or replacement. Madam Chair, I do have with me today Kirk Rosenberger, who is the Director of Solid Waste Management for Clay County, and Mr. Rosenberger is here to answer any questions committee members may have.
Thank you, Representative. Mr. Rosenberger.
Thank you, Madam Chair. I'm here with hat in hand. We have been working on this project for quite some time. And quite honestly, I'm getting tired of carrying around all this information. We do have all the information. I'm sorry. We do have all the information done. We have all the construction drawings done, so that's all ready to go. If you want to know the color of the tile in the transfer station or the color of the carpet in the problem material facility, we also have that done as well. And most importantly, which is probably the critical thing in my mind, is that we also have the permit, the operating permit from the Pollution Control Agency. So we are truly shovel ready. The only thing that's changed is our request has gone up because the price has gone up. Last year, our request was $7.3 million. We came close to receiving funding at that point in time, but what has occurred now is because of expenses, it's gone up to $8.5 million. So again, we're here to ask for your help to get this done. And as I mentioned, we're shovel ready. We're ready to go.
Representative Dean.
Thank you, Madam Chair. And I have a, excuse me, question for Mr. Rosenberger. So going from 7.3 to 8.5 million, was there any change in scope, or was that just in the rebidding of the project and the marketplace for construction currently?
Madam Chair, Representative, it's just based on the market change.
Same
It's a very
vendors, same everything?
Madam Chair, it's basically the same project, except it's just a different, you know, the prices have gone up because steel has gone up, concrete's gone up, labor up in northwest Minnesota has gone up. Virtually everything has gone up in price.
Representative Udall.
Well, thank you, Madam Chair. And just want to say that I think this is a very worthy project. It did come within an eyelash of being in the last bill, and I think that we should give it strong consideration this time.
Thank you.
Any further discussion? Thank you very much.
Thank you.
Thank you, Madam Chair.
Ms. Bourne, would you come back to the table, please? Yes. Remember, in your opening statements, you said that you've been making your request for 3 years now, and you didn't. We're asking for the same amount of money for WLSSD.
That's correct.
And your area is only 4 inches from Clay County. How do you think that your prices didn't go up and theirs did?
Well, our prices may go up, but I think we're comfortable in our ask. One of the things that I mentioned when I testified is the fact that a key component of our project is the cost of the generators themselves. And we were very pleased to see 11 proposals come back and those costs to be very favorable. We do expect that the 5.28 that we're asking for might be slightly less than 50% of the project, but we still believe that it's adequate for us moving forward. So I think we're going to be reasonably close in our estimate.
Thank you very much. Representative Lean. I think the scale of the project and the fact that it's single county might have an effect on your rising costs, but are there any changes in the local amounts for your project? Mr. Rosenberger.
Madam Chair, I'm not sure I understand your question. I think the contribution that we intend to provide, we have money in our reserves, so we'll provide about $2 million in reserves, and then the rest of the amount will be funded through a bond. We'll finance it through a bond. One other thing I should point out, it's just not Clay County that's involved with this. We're also a part of Prairie Lakes. And Prairie Lakes is a organization of 5 counties up in the area. And we take approximately a third of our waste over there to PERM to be processed and burned in the incinerator. And we do that at an expense. It's a $123 tipping fee at the PERM facility, and it's only $45 a ton tipping fee at our landfill. So we're really trying to mitigate the amount of material going into the landfill. And that's the purpose of this upgrade of the transfer station.
Yeah, because there's not much favorability in any community to open new landfills.
Madam Chair, I can attest to that. We work real hard to be a good neighbor, but being a good neighbor to a landfill is a challenge, let me tell you. That's why I don't have any hair anymore.
Is there any other outside information that you want to share with us that while we consider your request?
Madam Chair, I think our commissioners, our commissioner is going to be down tomorrow, and or actually tonight, I hope, if they can get in. And they're very, very supportive. They've been very supportive of what we were trying to accomplish. One of the things, the transfer station, and you may have made a mistake getting me started talking about trash, because I can talk trash forever. But one of the
It's a friendly crowd. It's a
Representative
friendly agenda.
Erdahl, I'm surprised Representative Erdahl has the ears left, because I talked so much at him last year to, to try and talk him into this. But at any rate, the
Thank
commission.
you, Representative Erdahl.
I'll try and spare you this year. But the commissioners, my commissioners, are very supportive of what we're trying to do. One of the things with the transfer station that is different than what's currently going on is right now the transfer station only services the Moorhead area. It doesn't service any of the smaller communities. We have a community next door, literally next door, Dilworth, Minnesota. They have to drive all the way out to the landfill to get rid of their solid waste. What will happen is that with the construction of the transfer station, they'll be able to use the transfer station, which will save money and will give us a better opportunity to manage the waste more properly. I think that's the biggest issue that for the transfer station from our perspective is there's a lot of stuff going into the landfill right now that shouldn't be going into the landfill. We should be trying to get it out of the landfill to try and prolong the use of that landfill for as long as we can. And that's the major reason why we want to try and get this done. So I'll cut it off now, but if you need any information, I invite you up to beautiful Moorhead to experience the prairie breeze that we have up there. And I know that committee came up last year and took a look at a lot of the information we had last year, and I certainly welcome you to come again this year as well.
Thank you.
Thank you.
Thank you, Representative.
Thank you, Madam Chair, committee members.
The next item on the agenda is the Metropolitan Area inflow and infiltration grants. Representative Hanson is going to present. It looks to me like he's got 1, 2, 3, 4 cooperative presenters.
Thank you, Madam
Tell
Chair.
us what inflow and infiltration, I is how I know it, but tell us about that and why it's a problem issue across the state.
Well, Madam Chair, I have my sewer team here today, and so if they could come forward, we have a number of local government officials and metro cities, and also the Met Council is available for technical help. Inflow infiltration is a problem often in aging communities where the pipe infrastructure, whether it's the mainline pipe under the road or the pipe going from that main pipe to the house, has cracks in it. Often they may be tree roots, and so water is lost through those cracks or comes in through those cracks. And you're going to hear two different experiences from, I think, Newport is here. Newport is coming. They have a little different situation where water is coming in a lot because of the geography. So what happens is that there is water lost, but there's also the opportunity for contaminants to be lost. So the material that's going through those sewer pipes may leak out as well. In the metropolitan area, the Met Council charges the communities for those losses of water. And in the communities that I represent, with West St. Paul particularly, they have been working since 2008, where the homeowners have to pay, they have an inspection, and if there's an upgrade, they have to pay that. And if they aren't able to pay that, it's actually put on their property taxes to pay for the upgrades in those pipes. So I have with me today, I think the first presenter is from Metro Cities, Patty Nauman.
Ms. Nauman, welcome.
Thank you. Excuse me. Thank you, Madam Chair and members. My name is Patricia Nauman. I'm the Executive Director of Metro Cities. Metro Cities represents cities in the 7-county metropolitan area at the legislature and the Metropolitan Council. So we have the distinct role in the local government world of representing cities at the council. Metro Cities appreciates authorship of House File 582 by Representative Hansen and does support this bill, which provides $10 million from as a capital appropriation that would be used for grants to cities in the metropolitan area that would qualify under a grant program to help them mitigate inflow and infiltration problems in their municipal wastewater collection systems. I want to just point out, Representative Hansen did a very excellent job of explaining the very sort of unglamorous technical term of inflow and infiltration, or I&I. This is a problem for many cities. I think over 70 cities have been identified by the Metropolitan Council as having what we would call excess levels of inflow and infiltration in their systems. The reason that this is becomes a very compelling problem for cities to address. Number one, it's a problem generally for infrastructure, but two, they are compelled by the Metropolitan Council to address these issues in their systems due to what we call an I&I surcharge program that was put into place in the mid-2000s. The reason for that was the council had identified that if this problem is not addressed, if we don't sort of try to manage the I&I, because of I&I problems, it's using up treatment capacity in the regional wastewater pipe. So the regional wastewater system ends up treating water that actually does not need to be treated. The Metropolitan Council has estimated that if this problem is not addressed, we're looking at having to build out, or the region would have to build out more wastewater capacity in order to deal with it. That comes with an upward price tag of over $1 billion to all metro communities in the region. And so in 2004, there was a task force of municipal officials in the metropolitan area, along with the Metropolitan Council, that took a look at this issue and came up with the surcharge program as a much more effective, efficient, and local way to address it. Still very expensive for local officials to address. It has lots of impacts on their budgets, particularly as they get more and more into dealing with the fixes, but it's far more effective from a cost perspective to deal with it locally than it is to build more regional wastewater capacity. Many cities do face significant challenges in trying to address I&I issues. This is one way that we believe would provide some important assistance to those cities as they work to address I&I in their systems. I'm happy to answer any questions, and I thank you for your time.
Representative Lee.
Thank you, Madam Chair. Can you or do you have information of how much this is causing the 80s communities that you have identified like over the last few years that you could share with us?
Pardon me, how much it's costing those communities? My understanding, and I think the Metropolitan Council can answer this question perhaps more specifically, but the cost to address this problem locally, both from the public side of the equation, sort of local public side of the equation, and from the private property side, is estimated to be over $150 million. Cities in the metro area that have been working to address I&I have spent, I don't know if the Met Council can assist me with that, but they are continuing to try to address the problem. But that's really the cost to address it locally overall.
If I could interject, Madam Chair.
Representative Hansen.
So, Madam Chair and Representative Lee, throughout the state with aging infrastructure, there's cost from inflow infiltration. The difference, I think, in the metropolitan area is the Met Council compels that there must be a fix. And so that fix is charged to the residents and then charged to the individual homeowner by the city and then charged when it's fixed up. So House File 582 is in front of this committee because we cannot bond for the private pipe, the pipe that goes to the home. And that cost is often borne by the residents. And you'll hear from West St. Paul later that they've changed their program so when property transfers, that has to be fixed up. What's in front of you is the main pipe that the city, the public pipe that's owned. And you're going to have that throughout the state where there's public pipes that are going on. But what we've done over the last 10 years has been in front of this committee and other committees trying to get some money to be distributed out on the greatest need because the mountain of inflow infiltration costs, the water that's there is getting larger. And as we have changes in big rainfall events, I think you'll hear from Newport, the system gets overcome relatively quickly, if that helps.
Representative Hansen, this $10 million, for grants, who decides on who's grant winners?
Madam Chair, members,
Ms. Nauman.
thank you. The grants that have been secured in past capital investment bills have been, the money has gone to the Metropolitan Council and they serve to administer a grant program. That grant program has been reviewed, vetted, formed with municipal officials from throughout the region. So the money, if you are a qualifying city, if we were to secure funds, if you're a qualifying city, you would be able to get funding under the way the grant program has been structured based on what you're eligible for and obviously based on the amount of funding available. So it's not a first come, first serve. It really is meant to be distributed to each city that is working to address their I&I problems. And if I could even just follow up on Representative Lee's question and Representative Hansen's answer to that, once a city is identified as having a level of excess I&I, the Metropolitan Council estimates what they think the problem might cost to address. So that city is basically compelled to do that or be surcharged. And no city has been surcharged because cities are actively working to address the I&I problems, but this would just provide some added assistance.
And you use the same format for choosing each time. So
Yes.
there's a formal
Yes.
request and all that kind of
Correct.
thing. Okay, Representative Erdahl.
Thank you, Madam Chair, and Representative Hansen, Ms. Nauman. This is a problem, of course, that we're facing across the whole state of Minnesota with our crumbling infrastructure under our streets, mainly because the pipes were installed in the 1930s, 40s, and 50s. Just wondering, how old is the pipe you're talking about in this instance?
Ms. Nauman.
That might be a question for the Metropolitan Council in terms of if you're looking for specific years.
The
And
exact
I mean,
date. I mean, the decade would be nice.
Madam Chair and Representative Verdell, it's variable, and I think if we could have a couple of our cities come up, they could tell you exactly how old some of that pipe is.
Mayor? Oh. Oh. I don't know.
Hello.
Mayor?
Yes.
Here?
Dave Napier, Mayor of West St. Paul.
Okay.
I'd like to say it's well over 100 years. We have one in Robert Street, underneath Robert Street, we found that's over 100 years old on the main line. But if I can, I would just like to say Representative Hansen did a nice job laying this out. In 2008, we were hit with a bill from the Met Council for $2.7 million to pay for all the treated stormwater that was coming through the infiltration method. And at that time, we were kind of shocked by it, a $2.7 million bill. And they said, you know what, we'll forgive that bill if you start taking care of this issue. So we had to take a lot of time in educating our residents of what is I&I. And so countless presentations by Representative Hansen, and we went in and we educated the residents on what I&I is, because, and still today there is some uncertainty of really what it is. They just know it's a big bill when they get it from their sewer company, whoever's replacing their line. So what we did is we tackled it right away. We didn't want to pay 2.7, and we took it serious and we tackled it. And in 10 years, I think we're halfway through our city. We've spent over $7 million that's including money that we've spent, money we spent through the residents had to pay out of their pocket, and also we received some early grants from the Met Council early on in the project, and which helped us get it started. But right now, we're at a point where we are, it's really affecting our residents. We have a lot of seniors on fixed incomes. We're getting calls. I got an email last week from a gal who her parents were having to sell their house to try to find a place to live, and they're tight on funding. And she's really taken back by this bill that she's going to have to pay before they can sell their house. So it was really kind of a hardship case. But there's several of those in our city. So we're dealing with those on a local level, but I appreciate the effort to try to get the Met Council more funds and maybe trickle some down to help our city. We have done a great job, I feel, in 10 years to accomplish 50% of our 20,000 population is pretty impressive. So we've took it serious. We've spent over $7 million, and we support this and hope that you do too. Because I think it's really critical for us to be able to show the residents of our communities that on a bigger scale, there's a push to help us. What's that? No wooden pipes that I know of. Madam Chair, any other questions for?
Representative Dean, did you have a question for Mayor Napier?
No, not specific.
Okay. Representative Lee.
Thank you, Madam Chair. Mayor Neighbor, can you tell us how much is this affecting your residents more like cost-wise? How, if there's an average of how much it's costing your residents to pay for?
You know, I would say it's probably anywhere, some are getting by with changing out a sump pump or something like that. Others are getting, it's about between 4,000 and maybe 12,000, somewhere in there. Average would probably be about 6,000 to 7,000.
Is that for the whole project, or is that a year?
That's for their project. So when they have a backhoe in their yard, that's what it's going to cost them, somewhere between 4,000 and 12,000.
Representative Constantine?
Thank you, Chairman Murphy. I heard the remark about a wooden section, and actually in Mankato, about 10 years ago, we did dig up a section that was wood, and they estimated it was from the 1890s.
Just don't build them like they used to.
No, it was actually still working pretty well. But as Representative Erdahl said, this is all over. Chair Hansen, is there a corresponding program for cities in greater Minnesota?
Representative Hans.
Madam Chair and Representative Constantine, to my knowledge from the state, no. I think cities have had to deal with it. The difference here between the metropolitan areas, the penalty's already there for these communities. If they don't do this, that sword of Damocles is there that they have to have to pay for it. And so again, West St. Paul being a city of 20,000 people, that those costs are already there. There's a consequence. So there's no voluntary best management practice. There's no suggestion. There's been very little actual grant money for individual homeowners. So by providing the public infrastructure, that helps reduce the cost that it essentially is dealt with. So, but there is not a specific program, to my knowledge, for Greater Minnesota. The problem is there in Greater Minnesota, but the wastewater, here you have this consequence that's there to try to deal with it right now.
Representative Pearson.
Thank you, Madam Chair. And I'm not really sure who this question is for, because I'm hearing about the penalties that it's the Met Council that's enforcing these penalties. Is that correct? Okay, correct. Seeing the head nodding. So when wastewater from a home leaves the pipes, how much does the Met Council spend on cleaning the soil after that has happened?
Representative Hansen.
Madam Chair, so Representative Pearson, the prevention is better than cleanup. So what's happening here is trying to reline those pipes or replace those pipes. And so that homeowner is bearing that cost. The Met Council is not bearing that cost. And so the pay is coming from both the municipal and the individual homeowner. So, and they do not have the opportunity to recover that cost. They're not a business. And what the mayor was mentioning, I have knocked on doors of people that are 80 and 90 years old that have lived in their house their whole time, and they have no means of recovering that fee. For that, they have to do it.
Madam Chair, so,
Representative Pearson.
but the Met Council is enforcing the penalty and collecting revenue for the water that's flowing out.
Mayor.
Madam Chair, yes. So when the water flows from the home, they go down and they treat it. It's sewer water, right? Or it's sanitary sewer water. They're treating it. When rainwater comes into it, it goes down there. They still treat it. It's in with all the other water. So they're just basically treating rainwater, and they want to get rid of the treating this. That's my understanding of it.
And that's my understanding of it too, but what I'm hearing is that the Met Council is enforcing a penalty if water's flowing out of the pipe, that they're not then spending money to actually treat, nor are they actually doing any reclamation of the soils where it's been leaking. So they're charging a penalty for that. And then if stormwater, which I guess I would presume 100 gallons of stormwater, processing 100 gallons of stormwater is less expensive than 100 gallons of wastewater, but they're still charging a penalty for the inflow as well. I guess I'm kind of confused that the Met Council's collecting this revenue in penalties and in processing fees, but then we're coming to the Capitol to ask for this repair, the fixes. Thank you, Madam Chair.
Representatives, if I can refer.
No, excuse me.
I'm sorry. Ryan Schrader, City Manager, City of West St. Paul.
Okay.
Right. Madam Chair, representatives, your administrator, I think, handed out this sheet. I think that will help a little bit in explaining some of the questions. On this sheet of paper that I guess you're getting now, this shows West St. Paul's specific circumstance over the last 10 years as it relates to distribution, treatment, and I&I in the sanitary system. So on the left side of the paper, down at the bottom, it's labeled MCES sewer charge. So over the last 10 years, that's the treatment charges that West St. Paul paid to the Metropolitan Council. So it's just the cost that we're billed by the Met Council for the water to run through the treatment plant, and then the city pays those charges to Met Council. Up above that are, it's labeled $10 million in distribution charges. What that is for our staff and our costs of operating the local system that feeds into the interceptor system that is owned by the Met Council. Up above that, there's a box labeled I&I mitigation costs, $7.9 million. That's the cost over and above those treatment and distribution costs that West St. Paul, as an organization, their taxpayers and their ratepayers have been burdened with over and above a typical distribution and treatment expense. And then to the right of that, that kind of shows a breakdown of who's paid those costs. So in all, 7.9 million, about $8 million, a little bit over $4 million has been spent by the public. So when the city has done construction projects to address I&I in municipal trunk systems, pipes, manholes, things like that, that's what that's for. And then there's about $3.8 million that's been expensed by the homeowners and business owners themselves. And then this money, the grant money that we're talking about, that we're supporting going to the Met Council, and then grants are distributed back to the public, to the cities. In our case, that $8 million, we've received $351,000 in grants from the Met Council to underwrite our portion of those costs. At the same time, the city, out of its sanitary sewer funds that we get from ratepayers, we've allocated about $900,000 back towards private homeowner expenses to try to mitigate some of the costs of those expenses. And then finally, in response to what the costs are for the homeowners, I see a lot of those bills because of that grant program that we have to underwrite those private expenses. And most of the bills that I see are in the $5,600 to $8,000 cost. I've seen a bill as high as $16,500 just for the repair to a private service line. The homeowner is responsible from the house to the pipe, not to the property line, but to the pipe. Thank you.
Mr. Schroeder, what's the population of West St. Paul?
West St. Paul is 20,000 people. It's a 5 square mile area. And if I may, it's been mentioned before how many cities this are eligible. There are 78 cities in the metropolitan area that are eligible for this grant funding.
Representative Dean.
Thank you, Madam Chair. And I don't know if this is to the bill author or to Mr. Schroeder. When I'm thinking about the $10 million, this $10 million then gets passed on to grants to cities like this Met Council 4%. And then the city, as part of its, assists other people that unfortunately can't afford it. So this is something that, we sort of move down to the chain for those people who are least able to make those repairs, because ultimately if those people don't make those repairs, then you're in violation of the Met Council's requirements. Thus, you get a fine of anywhere from, depending on the size of the municipality, $500,000 to, I think, Minneapolis probably gets imposed with a possible, $5 to $8 million fine every year, but they put that kind of money into repairing their water pipes. So I think this goes back to a little bit to Representative Pearson's question, and that is, we all as ratepayers, pay a fee to the cities, and the cities then pay a fee to the Met Council. And now the Met Council is turning around and helping to create this grant from all the fees that all of us pay into the system. And so we've, as I think of this conceptually, I think of it as a sort of this closed system. And if we want to keep costs down, the way we do that is by repairing the pipes. And the way we repair the pipes is we incentivize cities to do that. In the end, we all pay for it as part of our rates. I mean, I love your little pie where it says West St. Paul property owners 47%. That's their direct cost. But the city of West St. Paul's 49% comes from your residents. So I think that as we talk about this, we really need to talk about it, how this is a closed system, and we need to have the funding in place initially in the front end, so we're not incurring large expenses on the back end and continuing increased costs by not making sure that our wastewater isn't, as, which is a weird thing to say, as purely wastewater, and that it's not a bunch of storm runoff going into the system as well. Which, by the way, for most people, a small percentage is human waste that goes into wastewater. Most of it, it's dishwashers, laundry, lots of other bath water, all those other types of things that go into wastewater. It's not just human waste as well. Thank you, Madam Chair.
Representative Erdahl.
Thank you, Madam Chair. And I'm assuming that the cost is borne to the homeowners through assessments. Is that?
Yes.
Mr. Schroeder.
Madam Chair, representatives, yes, they have the opportunity for that. They could certainly just pay for the repair, but we will also assess the costs.
Thank you, Madam Chair.
Representative Erdahl.
Over how much time do they have to pay that?
Well, 10 years is a typical term.
Okay, Madam Chair.
Representative Erdahl.
Do you have any large industries that contribute to the wastewater?
Madam Chair, representatives, West St. Paul does have an industrial base. It's a relatively modest industrial base. Part of our requirements over the last 10 years have been that commercial properties needed to affect investigations of their systems and make the repairs early on. So I think most of those have been concluded. On the residential side, about half of our properties have been investigated.
Okay, Madam Chair.
Representative Erdahl.
Thank you. Just wanted to comment that in my particular case, the city of Litchfield, 50% of the wastewater is contributed by one industry. So it's a little bit different situation there.
Madam Chair.
Representative Hansen.
I think to get back to Representative Pearson's question, just to be clear, so when you have the pipe and it's got a crack in it, the stormwater is going in there. And then the system cannot differentiate between the wastewater and the stormwater. So we're either going to have to build a bigger system to handle the water because there's more water coming in. The more the infrastructure cracks, the more water comes in. The more water comes in, the more capacity you have to build. So to prevent that building out the infrastructure for treating water that is stormwater infiltrating into the pipes, the best way to do that is to prevent that from occurring, to reduce that inflow so that we're not having that cost of building the capacity to treat water that does not need to be treated. Is that right?
Yep.
Mayor Lund.
All right. Mayor Lund.
Hi, thank you. Dan Lund, Newport Mayor. I've been following along, and I'd push back against a couple things. At least in Newport, we don't have crumbling infrastructure. Our pipes were only put in the 1960s. They're 8-foot cast iron sections. The issue we have is the standard for stormwater treatment and discharge has changed since the 1960s. The system was built with an outflow to the Mississippi. If it rained too much, we got too much stormwater, you just open it, and most of that's clear water anyway. So we don't accept that anymore. We need to send all the water to the Met Council. There's two ways Newport gets hit with costs from the Met Council. The first one is the penalty we've been talking about. And it's not so much as a penalty as a fix-it ticket. So you have a certain period of time to spend that money on your system in order to not get hit with the fee. The second way is the way the way the Met Council allocates their costs for treating stormwater is on a per unit basis. And so if you send more water down the pipe, the next year your fees to the Met Council are going up. For most communities, this is fairly consistent. In Newport, we've had something changed with our groundwater. Our pipes are effectively underwater now, or at least some of them, and our year-over-year costs have gone up over 40% in the last 2 years from the Met Council, and that just adds to the burden of trying to fix it. So if we're giving the Met Council an extra, and Newport's a smaller community, we have about 3,500 people, so maybe 1/7 the size of West St. Paul. But if we're paying an extra $50,000 a year in fees to process this rainwater that's now in our system, well, that's diverting from our ability to fix it. In Newport, we've done a number of things to try to address the problem. And probably one of the biggest is our sewer rates charged to residents on an annual basis. We're in a 10-year stretch where they'll go from under $400 a year to over $1,000 a year. We spent over $1 million in public money on public infrastructure, including a lining project. For our particular problem, it frankly didn't work. We were told that the liner would take care of the problem, and so we've also worked with the Met Council on asking, and they've been very helpful for a library of best practices. Although every situation is unique, and our pipes, which are in the limestone bedrock, appear to be completely submerged, and some of these patch fixes that work in other areas have not worked for us. The total estimated cost to fully button up our system, which probably means replacing pipes, our engineer now estimates at $20 million. For comparison, our annual city budget is $3 million. So we're not going to get there on our own. And I can't speak to other cities, but Newport will not get there on our own. We're already scheduled to increase our water sewer rates to a level that's as high as anywhere in the metro, and that's to make incremental improvements, but it won't fix the problem. So, our problem in our little community is 20 million potentially. So the 10 million is appreciated, but this is a problem that's going to take a long time and a lot of sources to fix.
What is the population of Newport?
3,500, Madam Chair.
And with $3 million budget?
Out of our general fund, and so our enterprise fund would be, I think, around $1 million a year generally for the sewer enterprise fund.
Ms. Nauman? So if there was a bonding bill, or if there is a bonding bill, and in the bonding bill was $10 million for the Metropolitan I&I program of grants, how would the homeowners in the various cities, West St. Paul and Newport, if they were to receive a grant, one of these grants, how would that homeowner know that this money came from the state of Minnesota, from people all over the state of Minnesota to help their little town or their big town or their metropolitan community?
Madam Chair, thank you. So just to clarify, and I know one of the mayors here may have said the same too, the funding through a bonding bill, a capital investment bill, cannot be directly distributed to a homeowner for a private property fix. So the I&I problem does exist both on the local public infrastructure level, so the city-owned infrastructure, and then on the private property side. The request for you today from a capital investment bill would be to assist cities with the infrastructure deterioration and need for repairs on the public infrastructure side. I think what the mayors may have been trying.
Loosens up money then from the Metropolitan Council to give to their 78 participating cities.
Right. So it would allow cities, cities have taken various tacks at dealing both with the public infrastructure side of the problem and the private property side of the equation. The private property side of this issue is really challenging, both financially and politically. The public side is as well. Some cities, such as West St. Paul and I believe Newport, have undertaken more direct tactics to try to deal with the private property side. So having assistance both for the public infrastructure or having assistance for the public infrastructure allows cities to be able to deal a little bit more easily with the private side as well. So it's kind of all helpful. But the monies through a bonding bill would be for that local public infrastructure mitigation.
And then did we put big signs on the big fat pipes so that we're restoring, Representative Hansen, that says this is a gift from the Capital Investments Committee 2019?
Well, Madam Chair, since I haven't received any money for a while, I haven't had of my district. But the mayor and they do provide with their city newsletter whenever there's activity that residents receive that. I know it goes on the city webpage. There will be a request, I think Representative Freiberg has, that'll end up in Representative Lilly's committee where you may be able to see it for helping out the private infrastructure. The precedent has been set of using clean water funds to pay for that private infrastructure where there's a water quality problem to protect and restore and enhance lakes, rivers, and streams, Madam Chair. So that would, if that was funded, that would get a legacy placard because those have already been developed based on high quality insight provided 10 years ago. But the bonding bill, they also, if you talked about a big fat sign, they have given me a big fat time at the end of session to give a presentation on what happens at the Capitol at West St. Paul, and I would assume they would be doing that again. And I can tell you when I door knock, people know their I&I problems, and they will tell me as the road's been tore up, you know, what the cost was for them. And then they'll ask, what has been the follow-up? Has this made a difference? And the data is that it has. It has made a difference. Even these small increments make a difference, and obviously they make a difference in people's lives when they're having help with paying those big fees.
Good answer. Thank you. Representative Considine?
Thank you, Madam Chair. Actually, Chair Hansen's explanation of why stormwater is just as expensive to treat was what I wanted to go into, so he did that. But then for your question, they could always stick something, an insert in their water bill saying this came from us. Thank you.
All right, any further discussion?
Madam Chair, if I could just add to that, to your question as well. The Metropolitan Council, a couple of things on that front. So Metro Cities, we have been able to secure money in past bonding bills, and that does get, first of all, widely distributed. So cities are very aware that there is investment coming from the state to assist with this. And the Metropolitan Council has also recently put together a very comprehensive website, both for local officials and residents, on the I&I issue to help educate. And so that information does, both on the investment side and also what the improvement side is available on that site as well. And we've done our best to try to disseminate that information out to cities and residents in the metro area.
And it truly is a statewide issue, but since you're already there and intergovernmental in the cities, it makes sense to make this request. All right.
Thank you.
Thank you so much. The next item on the agenda is DHS Mental Health Crisis Center grants. First time with DHS. So welcome to the committee. Ms. Wilson, Deputy Commissioner.
Madam Chair, thank you so much for having me. I have to say, this is my first time in front of capital investment. I'm learning so very much about things I didn't know about, including sewage.
All are learning. Every single time we come to a meeting, there is something that we didn't know before. And so we don't even know very much about these health crisis center grants at all. So you better start with just the plain basics. And when did we do this? Or have we done this? Or are we just, this is it? This is the shove off for behavioral health crisis facility grants?
Madam Chair, yes, I will address all of those questions. And I thought maybe it would be best, since this is the Capital Investment Committee, to just do a very quick overview of the behavioral health system or the mental health system in Minnesota, just to sort of ground us in this particular moment and why these projects came into being last year. So, here in front of you is a slide indicating the prevalence of mental illness in Minnesota. And you can see here that we estimate about 20 in 100 individuals experience a mental illness. And about 20%, that translates to about 20% of children who experience what we reference as an emotional disturbance, and 20% of adults experiencing a mental illness in a given year. This translates to more than 300,000 children and 800,000 adults in Minnesota. So within that number, there's about 5% who experience a serious or persistent mental illness, which we define in Minnesota through a measurement of how frequently people are using high-intensity services. So right now, the mental health system that we are creating is not yet adequate to meet this level of need. And what occurs when we're not able to meet that level of need, of course, is great cost, not just within the healthcare system, but with law enforcement, with interactions with emergency rooms, and in our schools. So it results in a lot of damage. It results in damage to families and connections to our social fabric. And so the cost is significant. Nationwide, we're finding that mental illness is costing the U.S. an estimated $201 billion a year. And so that tops spending on heart conditions, on chronic conditions like diabetes, trauma, and cancer. So this behavioral health crisis is truly impacting both the financial well-being of the state and the nation, but also, of course, the well-being of our families and of all Minnesotans. But I do also want to say that we know with the right treatment that people can and do recover and live very full lives. And so with the right combination of treatment, services, and supports, we can work with Minnesotans to make sure that they are living healthy and productive lives. But we need more capacity in Minnesota to meet the need and to serve those individuals. And part of that is going to include collaborations with areas outside of social services and human services, like I said, including schools and healthcare systems and corrections, and working, of course, to find housing and employment and supports for people experiencing mental illness. And that's what we as a system are working to do and working to mature towards. So it is a complicated system because there's multiple entities who are responsible for the oversight of the system. So at the federal level, you see SAMHSA, that's the Substance Abuse and Mental Health Services Administration. They set the policy at the federal level. They operate a variety of mental health programs. They issue grants. They provide information and technical assistance to states. Then, of course, you see there the Center for Medicare and Medicaid Services. They are setting the federal policy and guidelines around our Medicaid and Medicare services and services that are covered under those provisions. The Minnesota legislature, of course, plays a big role in setting state policy for these services. And then DHS, the Department of Human Services, is the state's mental health authority. So we are responsible for disseminating the statewide policy and implementing what is passed at the state level and assuring that we're in compliance with our federal partners. Now, Minnesota It is still one of a handful of states that is state supervised but county administered. So you see on there the mental health initiatives and the counties and the tribes. The counties and the tribes are primarily responsible for the delivery of the services. So they are providing oversight, administrative and quality assurances, and working to make sure that they are meeting the needs of their regions. Now, they contract frequently with local mental health providers to provide the services in their communities. And these services are financed in a fractured way. So unlike most of the healthcare system that's financed, in a similar way, within the mental health system, we have some grants that are covering services that aren't covered by insurance. We have counties who are paying for local share of some of these services. We have state and federal dollars coming in. And as the system has matured, we've moved more services into the Medicaid benefit set. So more services are being paid for with, some part of a federal share and a state share, but we still have counties largely responsible for delivering a lot of the services. And of course, this also results, because of the fractured financing around the services, it often, results in more out-of-pocket cost for individuals. But we are working to build up this service continuum and to assuring that the services that we know can lead people into recovery are available in Minnesota. And so for that, I wanted to just familiarize you with the continuum of mental health services. So here you can see that we have our less intensive services. So those include outpatient, case management, rehabilitative services. These are services frequently accessed in the community. You don't need a facility in which for them to be provided in. And they are available, as an upstream, less intensive services. But then you can see we move then towards the higher level intensity of services, so crisis services, assertive community treatment, which is a team of providers working with individuals to address severe and persistent mental illness, and then of course hospitalizations, and then ultimately state hospitals. So if we walk back just a little bit, as this system has been in development, it was just in the 90s that we really deinstitutionalized the state of Minnesota. So prior to that, mental illness was primarily being treated in an institutional environment. And as we deinstitutionalized, regions became responsible for the care of these individuals. We began to build up these less intensive services, but we have not yet, as a state, found the right balance. So what's occurring is that we do have community-based services which meet the needs of people experiencing mental illness in the community. And then we have these higher level intensive services. But when people, get to the point where they require that level of service, they're frequently getting stuck there because there's not, once they've kind of passed needing that level of care, there hasn't been the community-based services developed yet entirely to meet their needs in the community. So we're having individuals who are stuck in state hospitals, individuals stuck in private hospitals, just not able to access the right care at the right time. So as a state, we have a real challenge in front of us in terms of how to appropriately balance care and build up community capacity while also addressing the need for high-intensity services. And that's really what led, I believe, the legislature to this discussion around how to invest in these facilities, because capital investments are not yet part of the system. Counties and providers are establishing facilities where people can be served. And so last year, the Behavioral Health Crisis Facility grants passed as part of the Omnibus Capital Investment Bill. And this is mandated under the law cited there, and it's $28.1 million for facilities to be constructed through general bond funding that will provide behavioral health programs. So this includes mental health and/or substance use disorder services. And then, of course, there was a provision that grants not exceed $5 million, and that then they be able to prove that they can meet the rest of their cost for their construction. Now, there were also some parameters put around this, and I will say that, this fund, the bonding funds were directed to the Department of Human Services to facilitate as grants, and this was new for us as a department to have bonding dollars directed. And there were also some parameters around it to assure that these facilities were going to meet regional need. So under the requirements, applicants had to demonstrate a need in the region for a facility that could provide services to the community. They needed to assure the sustainability of the services provided in the facility. There was certainly some concern that facilities would be constructed and then the services wouldn't be in place to be able to, in a sustainable way. And this kind of circles us back to that fractured financing. So regions needed to both demonstrate a need and demonstrate that they could sustainably support the services that they would be providing in the facilities. And then also a willingness to build on and integrate into other existing services. Because as I mentioned, what we're seeing is a flow problem. So we want to make sure that as people access these services, there are linkages to the next level of service, whether they be less intensive or more intensive, but assuring that there's warm handoffs and that people don't, kind of go back into the community to potentially decompensate further, end up back in an emergency room or end up back into some kind of, engagement with law enforcement. And then finally, they needed to be able to provide and agree to a comprehensive evaluation of the services and the financial viability of those services by the Department of Human Services. So the timeline for this was that in early September, the RFP was released. In October, there was a responders conference held and a frequently asked questions released. And then in December of 14, the RFP closed. Now, I want to say that during this period and prior to this period, the department was engaging in a lot of stakeholder engagement. Not only was bonding new to us, bonding was new to most of the mental health providers that work in these communities. There was, a differing level of counties who were prepared to put forward projects. For some, this was some new thinking for them. For others, they had been thinking about having these facilities in their regions. So we wanted to make sure that everyone who was able to respond knew the parameters and were aware that these had to be constructed in good faith with the community to assure that we were leveraging existing resources and that the community was aware and able to provide some input. So to that end, we also convened a review panel to review the proposals, and that was made up of various individuals you'll see here. In a moment, we'll have the list of those. But again, the purpose of this feedback was to ensure that applicants were able to meet the bonding requirements, to assure that we were addressing wherever there were gaps, and then to assure that it would eventually increase access to services statewide. So this was really a process that we were in a lot of conversation with the community around the construction of these facilities. Now, entities, because of the varying level of need in the regions and the varying level of maturity around being ready to respond to this RFP, there was an ability for entities to respond with a pre-plan or pre-design as well as a design proposal. I just wanted to give you a little taste of those who consisted of or participated in our RFP review team. That's mental health advocates, individuals and families, ED staff, crisis stabilization providers, substance use disorder providers, some DHS bonding experts that we had who'd been working on other bonding projects, and then our tribal and county relations staff. So these were individuals who both reviewed the RFPs and gave feedback on how they believe they were responding to the need in their communities. Out of the request for funding, we had over $37.1 million in request. Again, as a reminder, there's $28.1 million available in funding. We received requests from across the state, so there was a real balance of both Metro and Greater Minnesota requests. And we did receive requests for pre-design, design, construction, and then a combination of those two. So we are in the process of making those final selections. We are collaborating with MMB to make sure that we're collecting all the required documentation for bonding projects. And then upon execution of the contracts, we'll issue a legislatively mandated report to let you all know who these dollars were awarded to and where they're going and for what purpose. And then we will continue to work with respondents to assure that we're monitoring the viability of their programs and that they truly are able to remain sustainable in the community. You know, I believe that the hope is that if we can create more space and more facilities for people to be able to access these services at the right time. So again, if they don't need that higher level need, including care in an emergency room, or if we can disengage with corrections and assure that people are accessing a level of mental health treatment or substance use disorder treatment in that moment, then the hope is that they can be treated in the community and that we can address the flow issues. And I do believe that was partially the purpose for these dollars. And again, just as a reminder that the system itself is not matured to the point where there's a lot of dollars or investments available for capital projects. So that was the intent to the best of my knowledge around these grants, and that is where we are right now in the process.
Deputy Commissioner Wilson, were you part of this from the beginning, or did you just pick up on it lately?
Madam Chair, I was engaged with the legislature when they were considering this, and we worked with internally with the legislature as it was being developed. And so, yes, I've been engaged with, or my staff have been engaged with the project almost from its initiation.
Thank you. And is my understanding this came from the Senate side in the last, and that the House had no discussions about it before we got to the conference committee? Is that correct?
Madam Chair, that's my understanding. Oh, Representative Verdal is saying no. Is that?
Representative Nornes.
Madam Chair, thank you. And Ms. Wilson, thank you for being here. I thoroughly agree with everything you've said as far as the crisis. I hear that almost every day. I live in Fergus Falls, where we've had a large state facility. One of the first, I think, in the state was back in the 1800s, late 1800s. And the crisis is still with us. I guess this is my opportunity to say I think the state made a gigantic mistake when they decided those facilities, we call them institutions. I would refer to them, I think, if you call them hospitals, it has a better mental image. But the Fergus Falls Hospital, the Wilmer Hospital, the Brainerd Hospital all served a large area. And I think in the history of them existing, they did a fantastic job. I run into people every day that had some connection at some time to those facilities, and mostly in a positive way. So today, we still have one still standing, empty. Brainerd is down, closed. Wilmer's been redeveloped, and that's good. But in Fergus Falls, we have this large facility. Now we're talking millions of dollars to rebuild someplace. And I guess it's my chance to say the mistake was made in closing our facility. A few $1 million would make it really come back to life in a community that's very caring and used to dealing with those type of individuals. So I'm just, I don't know if anybody in my area has applied for these grants, but I've also seen where we've taken and redeveloped other facilities dealing with mental health, not mental health, but drugs and other issues. And the county has, for example, invested in a building of that type, and it's now empty. So it's a risk when you go ahead and become partners because you don't know, what the end result's going to be. The county is upside down now on that building because the state is no longer providing the service. So it's just a warning. And again, maybe advice that if you change some of this, say, let's just go back to the facilities that already stand and put some paint on it, you might have some services very quickly. So, thank you.
Ms. Wilson.
Madam Chair, Representative Norris, thank you for that. I do recognize that, there was many complications that resulted from the closure of state institutions. And, there's certainly a balance that we are still looking for in terms of how to adequately meet the needs of individuals, like I said, at the right time, in the right facility. I should mention that one of the barriers right now to sort of re-inhabiting institutions is that the federal government, CMS, has a restriction on the level of beds that can be within a facility and still capture federal funding, and that limit is 16 beds. So many of these facilities that would be being developed would have to meet that limit if they were going to provide any kind of residential level of care. And so that is one thing that prevents the state from building out institutions or facilities or hospitals that are greater than 16 beds, because we do want to be leveraging state and federal dollars and meeting the needs of Minnesotans. And so that is a preventative in terms of institutionalization.
Madam Chair, if I could just
Representative Norris.
make one further comment. I think that was started during the Pawlenty administration, building some of those small facilities. And again, when you're dealing with the federal government, some of it worked and some of it did not. And so it didn't work as far as the federal government being really an active partner. So, that may be the federal government's requirement. I think the state could do better if we ignored that and just said, let's do it our own way.
Ms. Wilson.
Madam Chair, thank you.
Representative Considine.
Well, thank you, Madam Chair. I'm supportive of this. I want to say that right off the bat, but this is like putting a Band-Aid on an axe wound. Persistent and mentally ill people are in institutions. They're called jails and prisons. And as the chair of the subcommittee, I would say we don't want them there. I kind of agree with Representative Norris. It would be nice to have maybe one of those brought back online for beds. I mean, if they're not in jails or they're not in prisons, the severe and mentally ill are persistent, are underneath bridges, they're homeless. Going out door knocking, listening to schools, law enforcement. We are in a crisis for a lack of places to put these people for any length of time. I'd make a pitch for a state hospital again. People I knew in St. Peter that felt like those folks were part of their family. I know there were horror stories that came out of those places, but there were also a lot of good people. And so, trivia question, where's the largest concentration of mentally ill people in the United States today? It is the Cook County Jail in Chicago. So, thank you.
Representative Erdahl.
Well, thank you, Madam Chair. And Commissioner Wilson, this was indeed originally a Senate proposal. Senator Senjum had this, but the House Capital Investment Committee took interest in this early on as well, and we had many discussions about it and supported it. Now, you mentioned the 16-bed capacity, and I'm aware of that. But also, I questioned and was assured last year that there would be outpatient care components as well. That is true, correct?
Ms. Wilson.
Madam Chair, Representative Erdahl, yes, that's correct. These facilities are providing, or at least in their proposals, they are proposing a variety of services to meet different levels of need. So that could include outpatient, it might include some crisis stabilization, but not everybody who comes through the door is going to require a bed.
Representative Erdahl.
Thank you, Madam Chair. Certainly glad to hear that. I would also hope that we have a geographic balance to this. We have in rural Minnesota right now, particularly with farmers who are approaching a mental health crisis situation, and that's why the geographic balance is important to this. Let's hope that we are successful. I just wanted to deviate quickly here and thank you, Commissioner Wilson, for the help that you gave on the block grant nursing program in Grove City. She was able to, the commissioner was able to cut through some red tape and a bureaucratic snafu that we had in Grove City and help to get the funding that we needed to keep that program going. So thank you.
Representative Salk.
Thank you, Mr. Chair. I'm going to take a tact at a different way of looking at this just to help understand the global picture of this. And I agree very much with Representative Erdahl. The discussions of this development, this system developing, were across both houses of the legislature last session. In fact, I think I might be able to dig up a bill that I had submitted at some point along with Senator Senjum on these particular efforts. One of the things I'm very concerned about with this coming online, this sort of triage for people that are experiencing a crisis. I'm type 2 diabetic. I'm going to use myself as an example. But let's say that all of a sudden my pancreas cuts out. And all of a sudden I'm laying in a park somewhere, and for most people in the world, I would look like I'm having a mental health crisis because of the way it'll manifest itself in the early stages. I will probably be shipped at this particular point in time, because we have not spun up the system in Rochester yet, that I'll end up probably down at St. Mary's. My daughter was just there with a splitting headache on the day that it was snowing. She got a CAT scan, and then she sat for 5 hours waiting for herself to be diagnosed and released. And the picture I'm painting is that if through the triage and the way the system works, we get flooded by the people on the street that all of a sudden are just going to swamp the system, we're going to end up with a bunch of people like my daughter who are sitting in a world-class health center but can't get anybody to talk to. And that, I'm very concerned about that, because I don't think we are adequately approaching this for how it is going to develop. I'll just lay that before you and let you respond.
She doesn't have time.
Oh.
Individually, she could.
Thank you very much. Thank you. Commissioner, thank you for the update. Representative Sansett.
Thank you, Madam Chair. I'd like to move the minutes of February 7th.
Representative Sansett moves adoption of the minutes as printed. All in favor say aye. Aye. Opposed? This meeting is adjourned.